Well, good evening, everyone. Thank you for joining us. On behalf of Orthopedic Rehab Specialists, I'm Robbie Williams. I'm a physical therapist at our Holt location. Thank you for tuning in this evening. I have joining me members throughout the Holt athletic program, and we're just going to use this as a roundtable discussion going through one, how we work together season to season dealing with injuries, but also because of the changes in the current pandemic we've been going through, we've had some modifications of various athletic events that will occur this fall. So I'm happy to have the Holt Athletic Director, Renee Sadler, joining us here today to go over some of those topics, answer any questions that our audience and viewers may have about what to expect with this upcoming fall high school season. And so without further ado, I'd like to introduce each member of our panel, and then we'll go into some questions. So joining us from Michigan State University, I'm happy to have Dr. Sheeba Joseph. Dr. Joseph attended medical school and completed her orthopedic surgery residency at Case Western Reserve University School of Medicine. She went on to complete a sports medicine fellowship at the University of Connecticut. Throughout her training, she had covered sporting activities from high school football to Division I and Division III collegiate football, field hockey, men's and women's soccer, ice hockey, and basketball. She also provides medical coverage at the Cleveland Marathon and the NCAA Women's Basketball AAC tournament. Dr. Joseph's clinical interests include adult and pediatric sports medicine, shoulder instability and rotator cuff tears, hip injuries and femoral acetabular impingement, knee joint preservation and ligament reconstruction, patellofemoral instability, cartilage preservation, transplantation, and athletic and overuse injuries. So we're happy to have Dr. Joseph joining us.
Thanks for having me.
I'd like to welcome Renee Sadler. Renee is the Holt High School Athletic Director. She is a graduate of Holt High School and Michigan State University. She is a lifelong resident of Holt. She has been involved in Holt athletics for most of her life, from playing to coaching and now as the head athletic director. She played tennis and softball for Holt and took up golf while at Michigan State University. Renee is married to the love of her life and has 2 grown children. Her kids were the biggest reason as to why she became active in educational athletics. She fell in love with coaching, and her daughter's travel softball teams later transitioned her to the role as JV softball coach at Holt in 2010. She was handpicked by the previous Holt athletic director to take over the role when he retired in 2016 after 24 years of service. She has since completed the 2-year certification in athletic administration program through the NIAA. Holt High School is considered part of the Capital Area Activities Conference Blue Division and has an enrollment of over 1,700 high school students. Last year, Holt had over 750 student athletes participate in 28 different varsity sports.
Thank you for having me. I'm glad to be here.
Thank you for joining us, Renee. And next, I'd like to introduce the 2 athletic trainers of Holt High School. First is Libby King. Libby is beginning her 2nd year at Orthopedic Rehab Specialist at Holt High School. Before this, she spent 2 years as a graduate assistant athletic trainer at Ball State University. She also previously interned with a team in the Southern Professional Hockey League. She holds a Master of Science degree in Exercise Science with a concentration in sports performance from Ball State University, as well as a Bachelor of Science in Athletic Training from Grand Valley State University. Libby is a certified board athletic trainer by the state of Michigan. Libby works closely with Holt Athletics team doctors, physical therapists, and her other partner at Holt High School, Matt Nicolai. Matt graduated from Saginaw Valley State University with a bachelor's degree of science in athletic training and Austin Peay State University with a master's degree in healthcare administration. He joined Orthopedic Rehab Specialist in 2019. Matt is clinically interested in using Graston technique and is BOC certified. He is the youngest of 3 and is a black tabby cat. In his spare time, Matt enjoys spending time traveling with his girlfriend, reading, running, and biking. So thank you for joining us this evening, Matt and Libby. We are pleased to have you.
Thanks, Robbie.
Thank you.
All right. So I want to get started with questions, and I figure I would like to start with Renee. And with Renee, just kind of describe your role and responsibilities as athletic director for Holt High School.
So athletic director, there are many, many duties and responsibilities, but I think any athletic director will tell you that our most important top responsibility is the health and safety of our student athletes, of our coaches, of our fans in the stands, of our officials, anyone attending our events, essentially. So working with our trainers is one of the most important jobs that we have. So that's always our top responsibility. I think the next most important job or responsibility that I have would be, just making sure that our student athletes are on track to graduate and that they are getting, that academic part of the student athlete and making sure that they take that seriously and that, not every kid is, academics don't come easy to them. So my role can be very helpful in that respect, where I can coordinate a student that's having trouble in one subject with, a tutor, or connect them with some extra time with their teacher, or just get them with a counselor and make sure that they have all the supports that we offer. So I think that is one of those jobs that's, behind the scenes, but is really, really important. And then I think the biggest chunk of my time probably goes to scheduling and game management. That's the easy part. That's the part that the public sees. When the game happens, when the whistle blows, it's a nice accumulation of all the little details that go in behind the scenes that are invisible. So scheduling and game management takes up a big chunk of my time, and it's not just scheduling opponents. With every event, could be transportation, there's officials, there's just game workers, making sure that you don't overbook your facilities, a number of things, making sure that your trainers are where they need to be. That's a big part, because at any one time at Holt, we could have up to 5 events going on at the same time. So that's one of those things where Matt and Libby, they are not just trainers, but sometimes they're helping me out with letting officials in, because I'm inside getting volleyball ready, or making sure that there's water for the officials outside at football, because I'm busy and getting swim ready or something like that. So coordinating all of those behind the scenes management type stuff is a big part of the job too. I hire, develop, and evaluate coaches. It's not just our student athletes that continue to grow. Our coaches do. And a lot of time I have the fortunate ability to pair up a new coach with a veteran coach, and then kind of get them into like a mentor relationship, so that that veteran coach can pass on knowledge to a new and upcoming coach. I'm a booster liaison. Our booster program at Holt is a vital piece to the athletic department. School districts just don't have all the funding necessary to help out the athletic department like they used to. So our boosters does a lot of fundraising for our teams, and we wouldn't be able to run without them. So I'm kind of that liaison between boosters and facilities. They run our concessions. So if they're having a problem with electricity in one of the concession booths, then I'll kind of work with our facilities department to make sure that they have everything that they need. So that's a fairly big chunk of my time. One of the things that I think I had no idea was going to be part of this job was I am part-time meteorologist. Deciding whether or not the weather is going to be appropriate to play at game time, is is part of my job. I'm watching radars. I'm looking at wind patterns. I'm watching the news at noon to see if it's going to rain at 4, because if it doesn't stop raining by 2 o'clock, then my tennis courts won't dry out. And if anyone that plays tennis knows that if you have any type of rain or condensation on a court, it's too slippery to play, which goes back into that top responsibility of health and safety of our student athletes. So yeah, I never realized that was going to be part of my job, but I am part-time meteorologist. But I think that all of that just kind of culminates into the whole philosophy. You know, all of those things brought together are the reason why we do this, and is to really just provide our student athletes with an opportunity to grow. And educational athletics, I like to say, is an extension of the classroom, where our student athletes are just continuing on the life lessons that are taught. You know, anything from how to be a teammate, how to work hard, how to manage their time, how to set goals, how to win, how to lose, all of that. So as an athletic director, that's the best part of the job, is when you get to see all of that come together and the light bulb go off for your student athlete. So it's all worthwhile.
Excellent. Well, I thank you again for joining us this evening, and I certainly will be coming back to you with more questions in regards to this upcoming fall season.
Oh, yeah.
Next, what I would like to go to, I'd like to go to Dr. Joseph and just discuss and describe your role and responsibilities as team physician with Holt High School athletics, and how you work directly with the athletic training staff, but also with the athletic director.
Yeah, certainly. So as you mentioned, I'm an orthopedic surgeon. I specialize in sports medicine. So with this background as a team physician, I'm readily available to the school athletic trainers, the coaches, all the related staff who may have concerns about any health or musculoskeletal issues for the student athletes when it comes to sports participation. In regular times, I'm on the sidelines of the football games that Holt hosts. But even for other athletic events, I'm always a phone call away for the trainers when they're working with the athletes, even at an event or at practice or just in the training room. So pretty close relationship, and try to make myself as successful as possible so that we can maintain an open line of communication and get the athletes all the care that they need.
Great. Well, thank you for joining us. And then next, I'd like to go to Matt and Libby. Would you guys be able to, can you go through and discuss your responsibilities as athletic trainers, how you guys work interdependently with each other, how each of your responsibilities may vary from one to another, and how you two work with the athletic director and the team physician?
Well, I guess if you're going to, athletic trainers do a lot, we wear a lot of hats, but one of our biggest roles is preparedness, I would say, and preventing bad things from happening, I guess, if you want to call it that. So one of the biggest things we have is creating protocols for when this event occurs. What do we do then? How do we make sure that the people that we need there to help us get there in a timely fashion, what everybody's roles are, and practicing, basically, like Matt and I will spend so long practicing, like, okay, if we have a neck injury, what are we going to do? How are we going to do it? What's your role? What's my role? Like, how fast and safely can we do it? Like Renee said, being a part-time meteorologist. And then what do we do when lightning strikes or tornado strikes? We have all of these protocols in place of, like, once this happens, this is what we have to do. And Renee also mentioned, like, you get to see the little blip of, like, us on the sideline, but you don't see everything that we do kind of behind the scenes. We are the person that's on the sideline during a game, that runs on when an athlete gets injured. We're always the first person when an injury occurs in practice or in games to make the decision of what's the next step. Are they okay to go back to play? Do they need to go see a doctor? Do they need to go see do they need to go to the emergency room? Those are all our decisions that we have to make. So how we prepare for practices and games, after school gets out, we will do our first like round of treatments of the day, getting everybody ready for practice, taping, looking at injuries that they had from the previous day, making decisions on that. We coordinate with doctors, coaches, athletic director. And I'd like to mention we have another team doctor who's not with us, Dr. Zakin. He's a doctor of osteopath. So coordinating between Dr. Joseph and Dr. Zakin, what the best scenario is for this athlete, what's the next steps for them. Trying to stay on track here.
I can add some stuff if you want me to.
There we go.
Yeah, like Libby said, a lot of our job, revolves around keeping the athletes safe and, making sure our spectators, our coaches, making sure they're all safe as well. So yeah, you do see us on the sideline and you see us, running out to the injured athlete, but more than likely if something happens in the stands and we don't have emergency personnel there, we would be the ones to, go up into the stands and, help out that spectator or, help out wherever the emergency is occurring. I know you as a PT know that and Dr. Joseph, you both know that there's a ton of paperwork that needs to be done when you see one of our athletes, and we're right there with you. A lot of our job is just writing down notes and making sure we're keeping detailed notes for each athlete, because Libby and I, on a daily basis, we could go back and forth and see different athletes. I could see Chance one day, but the next day I might be dealing with something else. So Libby can quickly look up his note and, go through what I did with him and vice versa.
I remember, Robbie, you had mentioned like how our roles are different. We aren't different in that regard, like we're equal partners. And so, yeah, we'll jump back and forth. Like I might do an evaluation one day, but Matt's going to take care of him the next day. And we just help each other out as much as we can. But we do divide our sports separate as far as like, these are predominantly my sports to work and these are predominantly Matt's sports to work. But under current COVID circumstances, that probably won't be the case this fall. But that we just did that to manage how many athletes we have. It was mentioned we had 750 student athletes last year, so it's a lot to manage.
And one other thing that I think is really important that they do that I'm not sure it gets talked about as much as it should is Matt and Libby are, the athletes respond to them and sometimes confide in them things that they may not confide in with other adults. They have a connection with the athletes that I may not have, or a teacher may not have, or even a coach may not have. And they're mandatory reporters, and I know that we have we have done some really good things on that front, where we've gotten some kids some help that they may not have even realized that they needed. So I think that's a really important part of what Matt and Libby do and what trainers do for high school sports.
Certainly, and definitely that line of communication when athletes, if they are injured and have to be shut down and they are coming into the clinic for rehabilitation, there's still that line of communication I have to relay with them of how they're progressing. Perhaps when we could start some sports-specific activities and just giving them as much data that's going to make their job easy with returning that athlete back to the field or court, whichever it may be. So certainly it's appreciated that with that line of communication, and really the big message I want to be able to instill with this meeting is how we work together as one giant unit, and really there can't be error in detail, and that we have to be able to all work together to keep our athletes safe, to get them on the field and have a successful athletic program.
Absolutely.
Next, I want to go to you, Dr. Joseph. Could you just speak a little on just the pre-entrance physicals that athletes are going to have to go through for this 2019-2020 season, and some possible changes because of the COVID pandemic?
Yeah, certainly. So I'll start off with what's usually happening is just in case people aren't aware, but preseason athletic physicals usually contain both a health questionnaire and a physical exam that is performed by a physician or an NP or a PA. And different for this particular year due to the COVID pandemic, MHSAA did come out with guidelines allowing athletes to use their physical from last year, dated 2019, as long as they didn't have any new status changes, but they also had to complete the health questionnaire and be able to respond no to all those questions. So upon completion of the health questionnaire, if there was any yeses, then they would need a new physical this year. But if that questionnaire is completed and everything's a no, they're good to use last year's dated physical. This was designed to try to reduce the traffic through physician offices and kind of help keep our student athletes less risk, I guess, if you will, to exposure. So.
Say for instance, those athletes that they may have not have participated last year and they do require a new physical this year, who is a health professional they can go see for these physicals?
Yeah, so generally kind of a first point person might be their pediatrician or their family medicine doctor. These are great resources for doing like an annual checkup, especially if you've had one done. Sometimes it can be a quick checklist that the provider can complete if the patient has, the student athlete has had a recent physical examination completed. So basically anyone with an MD, a DO, or an NP or a PA, kind of by their name, indicating they have the credentialing to be able to do a comprehensive physical exam to clear the athlete to participate in sports.
Okay. With these physicals, are they doing extra testing or assessment for COVID-19?
Not at present. It might vary from office to office, but generally speaking, most offices are doing screening questions of all patients that come to the office just to verify people that are walking in. If a person, a student athlete or a parent comes in and has positive answers to the screening questions, which are things like fevers, recent shortness of breath, sore throat, contact with someone who has had COVID, then the next step is taken to try to screen that individual and make sure that they have not been exposed or currently a carrier. So other than that, once those screening questions are completed and maybe most likely a temperature check as another screening measure, the physical examination and office visit typically proceed as they usually would under normal circumstances.
Okay, well, thank you for that. Next, I want to transition back to you, Matt and Libby. I think kind of as the athletic trainers, you're almost kind of that first line of defense, and especially that relationship and rapport that you guys are able to develop with the athletes. What extra are you guys doing to monitor the athletes during practices for signs and symptoms that they for COVID-19?
So pretty much the last portion of what Dr. Joseph said, the screening portion, the fevers, persistent cough, congestion, temperature checks. We do that all pre-practice or pre-competition. So our athletes come up, they are coaches. We have great coaches at Holt. They take their temperature, they move on to the next coach and, report if they're having any of those signs or symptoms. And then if they do, we can, take them to a isolated area and then contact their parents, come pick them up. Or if they don't, they can go on out to practice.
Okay.
Yeah, and so this online form that they're doing, only Matt, Renee, and myself can see the results of it. So we can also go in and check it and make sure that everybody didn't have any questionable answers. And then we're also making sure to be sanitizing everything that gets touched. That's our equipment, and making sure that we're using a proper contact time. So everything's been as clean as we can get it to be.
Okay. I want to go to you next, Renee. A lot of recent changing news over just even the past couple days about upcoming fall sports. What can you update us on about the upcoming fall season with particular sporting events and how much those things are changing and what you're doing to help protect and keep the student athletes safe.
Yeah, so I think the MHSA came out with a pretty big announcement last Friday. It just so happened that Holt also came out with an announcement last Friday as well. After a week of football and a couple days in of the other sports, the MHSA decided to move football to the spring season, and we fully support that decision. We're thankful for the MHSA's leadership in that role. Holt has also decided to postpone boys soccer, girls swimming and diving, and volleyball as well. We're gonna postpone those to the spring as well. Boys soccer is a pretty contact sport, and I was watching, Matt and Libby and I were watching practices, and as much as we were doing the pre-screening, and you just can't keep them social distance in terms of practicing. You can't keep them social distance and then prepare them for a soccer game. That health and safety in terms of not being prepared is just as risky as them coming down with COVID. So we just felt it was in our best interest to try and postpone to spring and push that back with football as well. We also are fortunate that we have some other area schools in our league that have also made that decision. So we will have somewhat of a mini league to play opponents in the spring in those sports. So that decision was made ultimately by our superintendent, but also based off of Matt, Libby, and my recommendation. Holt is also going 100% remote learning starting August 31st. And, without having students in the building really doesn't make sense that we could have volleyball players coming into our gyms. So that was one of the reasons why that indoor sports was also included. They're the moderate risk sports. Volleyball is pretty close contact up at the net with other volleyball players. Same thing with swimming. Our pool deck is not that big, to have the multitude of athletes, swimmers that we have on deck. So putting health and safety first is, like I said before, is our top priority. I think it's our number one responsibility that we have. So that's kind of where we're at right now. In terms of the low risk sports, tennis, golf, and boys and girls cross country, we're gonna go ahead with those sports this fall. We're taking, like Matt said, all those pre-screening protocols are in place for all of our sports. I think the most important communication or most important piece to COVID is just communication, and having Matt and Libby communicate with our coaches as to, what to do if you suspect a kid, has some symptoms, or, just making sure that we prepare them that they have all the PPE necessary that they should have, the hand sanitizer, that they're sanitizing any shared equipment if they are sharing any equipment, that they're wearing masks when they can't social distance. Matt and Libby are very good about, you can hear Libby every now and again on the tennis courts yelling at the kids, 6 feet apart, 6 feet apart. So, because kids tend to congregate no matter how much, how smart they are, they want to be around each other. So having Matt and Libby out at those sports is a vital piece.
For our viewers, is there any particular website they could go to get more information on this and the changes for the upcoming fall season?
Sure. So our Holt Athletics website you can get to it a couple different ways. If you go to the HPSK main website, down around the middle of the page, there's a sports tab. You just click it and it takes you to our athletic website. Or if you just type in holtathletics.org, that will have all of our most current schedules as they evolve. There's still a lot of changes going on with scheduling right now. So, but that will always have the most up-to-date schedules in terms of boys cross country, girls cross country, boys tennis, and girls golf.
Okay, thank you. I want to go back to Dr. Joseph. Could you just discuss the preparation you go through with the athletic trainers for particular events, and especially with the changes and safety precautions, social distancing, and things like that at various athletic events? Can you talk about just a routine you go through in working with athletic trainers before a game contest?
Certainly. So usually before the season, but now because I've been with Holt here for a couple years almost, I just meet up with them to verify where EMS is located, if they will be available at the event. So I'm aware of where our actual resources and support staff are located, and we can make the trip smooth if that needs to be utilized. And then before each event, generally if Matt or Libby have any athletes that they're watching or might have an injury that they've been monitoring or concerned about, any weakness or concern for optimal play, they'll let me know and kind of update me on that aspect of the athlete's care. If there's any athletes who have had an injury since the last time I was present, I may take a look at them before the start of the event and do a quick evaluation and kind of provide recommendations if I think they're ready to get back into play at that time, or if they need further workup or further conditioning, whether that be with Matt and Libby directly or more formally with physical therapy input as well. So those are kind of some of the first kind of basic things that we go through before each event. As far as the screening procedures, that's to be ongoing, as Matt and Libby have already mentioned, going through all that temperature checks and questions of all the athletes to make sure that they're all staying healthy on a daily basis as they get into contact with each other. So
I guess we should also mention that our coaches also go through the screening process. We don't just screen the kids.
We go through it too.
Yeah, everyone gets a questionnaire and a temperature check before we get to, do anything for the day.
Before I go to the next question, I just want to remind our viewers that we will be taking questions at the end of the meeting here. So just kind of at the chat component at the bottom of the screen, if you have any questions, please feel free to submit those. And it also looks like we just have posted that Holt Athletics address that Renee provided for our viewers if they would like to check that out for any information on the upcoming fall season. Renee, I want to go back to you, and can you just discuss in detail a little about just the emergency action plans that you established working with the physician and the athletic trainers, both for indoor and outdoor sports for the upcoming season?
Sure. So the emergency action plans are what would we do in an emergency, and they can. We have one for every scenario that we can think of. What do we do in case of an emergency in terms of injury? What do we do in case of lightning? What do we do in case of a tornado? And Matt and Libby have done an excellent job. Every year at the beginning of the year, they go through their emergency action plans and they make any updates that are necessary. Matt always sends me a copy and has me go through it to make sure I'm on board with everything that has been laid out. And it can range anywhere from making sure that the pathway for an ambulance is, the quickest, shortest, and most convenient route. And then, telling the ambulance which door to enter. So for our gym entrance is door 26. All emergency first responders know that in a high school, all the doors are numbered on the outside. And the emergency department in our area, Delhi Fire Township, they have a map of where all of our doors are. So the emergency action plans specifically state for each venue what to tell our first responders. So in our gym, it says posted up there, when you call 911, tell them to enter door 26. So it's extremely important that those are right. So the emergency action plans, like I said, Matt and Libby and I, we go through those at the beginning of every year. We make sure that they're posted on all of the venues. And Matt and Libby do a really inventive and neat thing. They laminate them and they put them on a chain, and they chain them to the water coolers. So it's real convenient for a coach in an emergency, which, in an emergency, you kind of go crazy and you forget your wits about you. Then if all you have to remember is go over to the Gatorade water cooler and then follow the directions, then that's a pretty neat thing that Matt and Libby have done. So yeah, I think, Matt, am I missing anything, guys?
I don't think so. I mean, it has our contact information. If like one of us happen to be, Libby's at soccer and I'm at a football game or a volleyball game. So it has our phone numbers. It also has Renee's phone number. So if the coaches, they're not sure to call 911 or not, they can call us and we'll be right out to the field as soon as possible.
Okay. Certainly, while we're on the topic of safety, going back to you, Renee, and this is a question from our panel here. While the sports that are allowed this fall, will the sports that are allowed this fall be allowed to have fans, family? Who will be allowed to attend? Will there be safety protocols in place for those various visitors and athletic events?
That's a great question. And Matt and Libby and I have been using this term frequently, fluid. It's a very fluid situation. Currently, as it stands, the governor has executive orders in place as to how many people are allowed at an event. And that would include the players and the coaches. So we're kind of waiting for some more guidance from the governor and from the Michigan High School Athletic Association. In terms of cross country, our league has come to an agreement that we're going to ask parents to stay away from our cross country ending the finish line, the chute it's called. That's obviously where people tend to congregate, and we just think in the best interest and safety of our coaches, our officials, and our athletes, we're just going to ask parents just to sit that out for our student athlete safety. We really want to make sure that we provide the safest atmosphere for our kids. And so we're just going to ask parents to hang back in the car, in the parking lot, and wait for their student athlete in terms of cross country. And that's kind of been decided as a league. And but as far as tennis goes, we're not quite sure yet. Like I said, we're still waiting for the governor. In terms of regardless of anything, our coaches are going to ask for parents' help and just maintaining that social distance. We are outdoors. However, we're gonna take every extra precaution that we can.
Okay. And for those sports that are being moved to the spring, I think you probably have already answered this, that it's still probably up in the air pending, but same kind of rules apply for sports this upcoming fall as well, that it's going to be kind of taking on a mandate by the government and things of that nature.
Yeah, I think as long as we really believe that if we follow the protocols, the safety protocols that are put in place, that we can complete the season, and that's the goal. But certainly, if there are any hiccups along the way, then we're gonna, we will always put the health and safety of our student athletes above anything else. So I anticipate, as long as our community, pitches in and is doing the right thing, I think, we're at least in Ingham County, we've been, our numbers have stayed low, and, I'm hopeful. I think that's the best I can say is I'm hopeful.
Dr. Joseph, along with physical medical issues, do you feel like athletes are going through some mental stress and difficulties during this time as well, especially with changes in season, overlapping of sports that one might be able to play in the fall and spring, but now they may have to determine one versus the other?
Yeah, certainly that's going to be an issue that we'll probably see arising here to the surface as various sports are not being allowed to continue in competition this season. So, that's huge. Like Renee pointed out, Matt and Libby are kind of that first line for the student athletes, and they do more than just caring for their athletic injuries. Sometimes these people are confidants for the athletes, and they can be moral support and mental support for the athletes. And even though I'm an orthopedic surgeon and I don't specialize in all the mental aspects or the emotional health, but if there are athletes that have those issues, we certainly can reach out to our resources at Michigan State and try to get the attention that they need. But you touched on a very important point, and as students in school, athletics can be a huge part of their life. And not only now transitioning to remote learning and not being able to have that social connection with their teammates, their classmates, it can be a challenge. So we'll have to stay on our feet and be there for the athletes when they need us.
Yeah, and if I can just tag on to that as well, one of that is absolutely one of the concerns I had in postponing sports, and Matt and Libby and I talked about it as well. And one of the really powerful things that we have at Holt is our coaches. And even though they aren't going to be necessarily face to face as much as they had planned, that's not going to stop our coaches from checking in on our kids. And I'm proud to say that out of the 9 sports that we hold in the fall, 8 of them are coached by teachers. So we're very fortunate to have that coach-teacher ratio. And our coaches are committed to checking in on our kids. I've got some coaches that have done some pretty out-of-the-box type thinking in terms of still being able to make those connections even face-to-face. In the spring, we were shelter in place where everyone was kind of hunkered down, and we're not shelter in place, but we're just minimizing our contact. So I know I've got some coaches that are, kind of working on small pods and still doing maybe some conditioning in terms of physical conditioning where they can spread out and keeping our kids physically active, but then just also that connection, with their teammates and then with coaches, and just that face-to-face check-in and just saying, hey, what's going on? How's remote learning going? Do you need any extra help? Do you have the technology that you need? And that's the beauty of that coach relationship that Holt coaches have with our students. So I feel very fortunate for that.
Matt and Libby, I want to go to you two. Surely we want to be able to prevent all injuries from happening, but unfortunately that's not always the case. How are you two, working together to help develop a rehabilitation plan, and also working with Dr. Joseph to coordinate an evaluation and then scheduling further consultation with physical therapy if that's recommended?
So prior to COVID, we would have a physical therapist that would come to the high school once a week. So if we had anything that was kind of lingering, or we thought maybe they need to go to physical therapy, then we could actually have them go see that physical therapist. And it'd be a pretty easy consultation. Dr. Zatkin is always, he makes himself pretty available to drop by the school if something happens on like a random day and it's like, oh, this happened, like what should we do? He drops by. If we know that we need to probably have some imaging done or something else like that, where they definitely need to go in to go see Dr. Joseph, then Dr. Joseph has always gotten, if I give a phone call or a secure email to her, she's always gotten them in within 24 hours. And Matt and I can bounce ideas off each other because we have different strengths as far as rehab, and we can collaborate with a physical therapist too, because the physical therapist probably, if they are going to or asked to go to physical therapy, they're probably only going there 2, maybe 3 times a week, maybe only once a week. So the physical therapists are awesome at saying, okay, well, we're going to see them on Wednesday. This is what you could do with them at the school on Monday, Tuesday, Thursday, Friday, to kind of like offset the other stuff that we have going on.
I don't have anything to add, so.
That was a grand slam answer there. And so I want to go to you now, Dr. Joseph, and really just discussing the importance following an injury, the level of communication you need from the physical therapists, the athletic trainers, when a patient does come to you for a return visit in the clinic, or if you're seeing them in the training room, about gradually restoring return to play and progressing them to more advanced athletic activities.
Yeah, certainly. So, I mean, that's kind of the benefit and the beauty that we have of the world we live in right now. Technology has made it very efficient and easy to communicate in a very light speed fashion. You know, I've seen patients or student athletes in the office that had been seeing Matt or Libby the day before, and I can just pick up the phone and call one of them and ask about, you know, how things were, if they couldn't remember certain activities that they were trying to do or rehab techniques that they were trying to follow. It's very easy for me to communicate with them. And same thing goes with the physical therapy support piece. I received the notes from those visits, and I can kind of monitor how the student athletes are progressing through the rehab from an injury. Really, it's just great that we can communicate so quickly and easily amongst all parties involved. And then Matt and Libby have access to the coaches as well. And so, you know, if there's ever a situation where an athlete needs a little more time before they get back, or we have like a graduated program that we would like the athlete to work with, starting off with some non-contact work or some agility specific things, they can collaborate all of that with both the coaches, the trainers, and the physical therapists, so that we can kind of have the most efficient and supportive program for the athletes to get back into their passion, really.
Excellent. And I think that really gives light to, again, the effect of communication and availability between all of those involved within the sports medicine program, to making sure that continuity of care is consistent and everyone is on the same page. It doesn't matter if you're seeing the PT, the athletic trainer, or you're doing your follow-up visit with the physician. With that, there's really minimal error for attention to detail, and it goes really a long way. So with that, I'm just taking a look here. We'll leave it open to our audience. If you guys have any remaining questions, I could ask our panel here. We'll give that a few moments. But again, I think we're all really excited for fall sports to resume here in the upcoming weeks. And Renee, it sounds like you guys have put together an excellent plan to keep our athletes safe, not only the athletes on the field, but those visiting, and then also our spectators that will be coming to view the various contests throughout the season. It does look like I have one question here. With an injury, and it sounds like this is for Dr. Joseph and our athletic trainers. With an injury, where's the first place to start with consultation? What should parents do? Are you available to the athletes at the school, or do they have to seek you out in clinic?
Yeah, so kind of for injuries that occur maybe outside of a event or a contest, the athletes can certainly reach out to Matt or Libby, and they have direct access, like Libby mentioned, to me. You know, sometimes they may feel that it's not necessarily something surgical per se, and they may triage that to Dr. Zatkin with his osteopathic manipulation background. So they kind of help triage and figure out where's the best location for the patient, the athlete to get seen first. If that happens to be with me, then I certainly will reach out to my front staff. We usually request the athlete's parents' name and phone number, and then my office contacts them directly to set up all the information to get them into the office ASAP. And then we kind of go from there and take care of the student. I don't know if Matt or Libby have anything to add to that.
Yeah, that's pretty much how we do it. Even in an athletic event, we try to do a lot of work in-house or in the athletic training room. And we definitely use our resources. We've called Dr. Zadkin at 8:30 and he said, I'll be to the school by 9. And, he shows up and luckily we won't have to send them over to Dr. Joseph, for further imaging or whatnot. But yeah, it's just using that triage system. We don't want to overrun her or our physical therapist. So if we can do it in-house, we will, but we aren't afraid to, tell mom and dad, hey, we need to get a picture taken. And luckily we have this great doctor on our staff. So we can send you right over and get you in pretty quick.
Yeah, what's the first step in consultation? It really depends on what specifically the injury is, what our first step is going to be, and who's the first person that we're going to contact about it. And then I think that it also said, what do parents do? We give our business cards out to almost to every parent that we talk to. And we encourage them to contact us all the time. Like I have taken phone calls at 6, 7 a.m. on Sunday morning because they're just like, this happened overnight. What should I do? Has it progressed enough? Parents are concerned. Our main thing is the athlete safety, but also we want the parents to be confident in what we're doing. And we don't want them to be stressed out and just leave them to deal with that on their own. We want to be there for the whole process and we want them to know that we're invested in their kid too. So we make sure that the parent knows, the second that you have a question, let us know and we'll help guide them in the right direction.
Fantastic. Well, it looks here, really, I don't believe there are any other questions. From my end, I really appreciate all 4 of you taking time out of your evening to sit down and have this conversation. Incredibly informative on various roles involved in that. Really, it's not an individual thing. This is definitely a team effort. And I really thank you on behalf of orthopedic rehab specialists for joining us this evening. And I really look forward to the upcoming weeks and months ahead as the athletic programs start to gear up and get rolling into season.
Well, I can say on behalf of Holt, we are very grateful to have partnered with ORS. I think our athletes are one of the luckiest kids around, and starting with having access to 2 trainers and having access to 2 doctors, and just the level of care that they get at Holt is top notch, and it starts with ORS. So in making those connections and for being for really developing relationships. And Matt and Libby are just starting their second year with Holt, but they've already connected with our student athletes, and that is probably one of the most important roles that they have. So Holt's thankful to ORS for our partnership, and we look forward to continue this for the long road.
Certainly, yes, the continuity of care goes a long ways when everyone is able to be involved and on the same page. We're not missing those various details that are really important for keeping our athletes safe. So again, I'd like to thank you all for your time this evening and enjoy the rest of your week.
Thanks, Robbie. Appreciate it.
Thank you.
Thanks for having us.
Take care, everyone.